kirombe cha zahabu.
Yavuka mukwano gwange
Mugaka ninacho mugaka tusibe kabefezo mu kirombe cha zahabu. Kirombe cha zahabu. Ni mugaka ninacho mugaka tusige sibika befezo mu kirombe cha zahabu.
Sikusanze umwana w'omuntu ensi zikusanze nawo omwana w'omuntu ebibonyobonyo bingi naye mpangudde ensi najja mu matwale gange ensi teyantegeera ebyaliwo naye nawangula ensi olaba kiba ku muti omubisi naye ate mmwe mugume musabe musiibe munywere ebirijja mujjukire embuulire tefa yonna yagamba yasuubiza mwesigwa aliponya mu masa mangi muyiganizibwa oba ntalo mukisiikirize ekyolumbe byoyitamu abiraba alisangula amaziga gaffe mwekabire n'abaana bammwe musabire abaana bammwe ensi kebakunjula ensi tesaasira nali muto kati nkuze kubyendabye nga nkula ndabye emyoyo gy'abantu yagamba okumempango n'ensi yasuubiza mwesigwa alinona alindokola enjala oba bwavu musabe nga temukowa mubike malibawe ekkubo sisitaguma oladaguma alisangula amaziga gaffe
Good evening, everyone. I welcome you all to our program. Today is Tuesday, the 20th of July, 2020. I hope you are all doing fine. I welcome you to our program, Obulamu, broadcasting live here at Big God TV, Aksaray, in Turkey, Istanbul. I thank you all for watching our programs and always sharing and joining us every other time we are broadcasting live. And those of you who are watching from Facebook, thank you so much for always joining us, and thank you for showing us that love and loving other people too, because by the fact that you're sharing our videos, it means you pouring out your love unto other people so they can learn too. My name is Esther Ebiachu and I'm a health worker, and by the grace of God I'm a minister here in Big God Church. And I want to extend my sincere thanks to my dear pastors, Pastor Viola Daniels. Thank you so much for the platform and for the vision that you've given unto us. Pastor Matovu Isaac, thank you so much for allowing us have this platform where we share our views and ideas. And for those of you who are watching us, you can always join us on our Facebook page whenever we are streaming live for different programs. Learn about the Bible, learn how to read the Bible and understand it, get inspirational Bible verses every morning of each day before you go to work at 6 a.m. You'll find that Word for You Daily Bread is always here, happening every morning on Big God TV. And it is majorly hosted by Big God Church here, Big God Church International Revival Ministries here in Turkey, Aksaray, Istanbul, basically, specifically in Kumkapi. So today we are here for the program of Lam, and I thank you so much for always joining us, and for those of you who have been following our programs. We've been talking about infections. And last time, our presenter, our host, who hosted the program, still continued with infections, and I know you got to learn much more about that. And so today we are going to talk about viral infections, and these are so much like it's a wide topic too, and we've started it today. And I ask you to keep following us, and please make sure that if you have a question of a previous presentation that was made, previous topic that was taught, or a question regarding the topic that we are talking about today, please don't feel shy to always send it in to us. Or if you feel like you cannot send it to the whole public, if your question is so personal, please, you can send us your message on the numbers that are flashed on your screen, and we shall always make sure that you are answered. You can contact us on our WhatsApp, or you can send us a direct message, or you can give us a direct call on the number on your screen. So thank you so much, everyone, for joining. So today we are looking at viral infections, and if I'm talking about viral infections, these are just a proliferation of different harmful viruses that come into contact or inside your body and then start reproducing and then bring so much other things that will cause disease into your body. And there are so many types of viral infections affecting the whole body system, right from your head to your toes. So like it's just the whole body system inside out. They could be skin viral infections, they could be inside your body organs, the liver, affecting the liver, anything else inside. So this is quite a wide topic, but we shall go on like talking about a few things bit by bit, and I urge you to always continue watching our programs so that you keep track of the lessons that we are teaching. Maybe you could help out someone out there who could be like suffering from the same infections, especially for those of you who are abroad. Most especially, most of you fear to go to hospitals. And if you're watching this live, that is why I continue urging you to share it to your contacts, call your friends, watch with you if they don't have smartphones. And if they do have, share the links with them. And I want to assure you that you'll be blessed for sharing always our videos. So I want to first talk about the respiratory viral infections, and these always affect the throat, the lungs, and then they cause different signs and symptoms, and they are usually spread through contact with the droplets that someone brings out. So it means like with the respiratory viral infections, you find that if someone gets a respiratory viral infection, he or she will start coughing, sneezing. And if you're next to that person, you find that whenever they cough out, they spread out, they bring out droplets that usually if you get into contact with them and they are infected with a viral infection, you find that you also get it. So we have examples of respiratory viral infections, and we have the rhinovirus. This mostly is responsible for causing you a common cold. That is when you find that, in this case particularly, you find that the common cold symptoms will be like coughing, you'll be sneezing quite a lot, you'll have quite a mild headache, and these symptoms usually last for 2 weeks. Sometimes they may go untreated, that is sometimes, depending on your immunity, and sometimes they may need treatment regarding depending on how you respond to the signs and symptoms or to the manifestation of the virus that you are getting. So we also have the seasonal influenza. These usually happen in continents or countries that have extreme peaks of the temperatures at different seasons. So in states like the US, the European states, states that experience very high temperatures and very low temperatures, you find that this the seasonal influenza virus is so common, and this will be manifested by the signs and symptoms that are almost similar to those caused by the rhinovirus, but you'll find that these will have a severe manifestation compared to the common cold. You find that it will also be associated with body aches, it will also associated with severe fatigue, and you'll find that these symptoms usually happen so suddenly. So I want us to differentiate between the seasonal influenza and the rhinovirus. And usually, the rhinovirus is responsible for the common cold, and for the common cold, sometimes you find that depending on the seasons, if it's so cold, that is when you find that you start coughing, you feel you have a sore throat, and you feel you are sneezing, and you have a mild headache. And usually, for you to differentiate that whether it is just a common cold, you find that it will usually last for 2 weeks, and then the signs will subside. And I usually hear people say, me, I don't treat flu, so when it comes, I just take water and it will be gone in 2-3 days. Yeah, sometimes it is just a cold depending on the temperatures around your environment that you're in. And sometimes you find that your body has the ability to fight against the virus, and then you find that you're healing instantly. And these symptoms usually come bit by bit. If these are caused by the rhinovirus, you find that they usually come bit by bit. They are not sudden. But if the virus is a seasonal influenza virus, you find that they come so suddenly. And you find that so suddenly you're severely having a lot of fatigue, you're having a headache, your body is all aching, and you're all having signs of a common cold. And that is when you'll have sometimes to seek medical attention, because they seem and usually tend to be so uncomfortable. I want to remind you that you are watching Big God TV, and we are broadcasting live here in Turkey, Istanbul city, here in Aksaray, Kumkapi, and our main hostesses here is Big God Church, Big God International Revival Ministries. I want to extend sincere thanks to the production manager. Thank you so much. And the program manager too. I want to thank you so much for the good work you're doing. And I want to thank everyone doing everything you can in your power to make sure that TV is still broadcasting, because we are reaching out to so many different lives out there. So we are still continuing with our topic. We are still looking at the respiratory viruses, viral infections. So for those of you who are experiencing this, sometimes some people really get to have a flu-like symptom. You feel like you have a flu, and you have that blockage in your on your nose, and you don't seem to get over it. Sometimes usually happens during winter seasons, and you find that it's really quite hard to treat that. You may need to seek for medical attention, because the health workers always know what to do for you in case of those persistent symptoms, because sometimes some of them may need medication for you to actually get some relief. So we also have, among the respiratory tract infections, we have the respiratory syncytial viruses. These usually both cause the upper and the lower respiratory tract infections. And for the lower respiratory tract infections, you find that these may continue to bring or cause a pneumonia and also bronchiolitis. Now, these infections usually are found in babies and young children. Now, there's a difference between babies and young children. Of course, the babies are those that are still in months, and the young children are, you may count them from the infants. Yeah, so usually the pneumonia, bronchiolitis, with the infections that I've talked about, you find that most of them affect the babies and the young children and the elderly people. And for the elderly, it is because, of course, as you're aging, your body system is also aging, and so you're prone to so much more that if you're not really so careful, you may find that you're getting these infections so often. So for the management of the respiratory tract viruses, respiratory tract infections, most of them you treat them asymptomatically. Some of them may not need really medication for you to treat them, but some of them, if they develop into pneumonias, into bronchiolitis, you need to seek medical attention. And to some cases, you may find that sometimes, if not attended to so fast, you may find that they will need to be hospitalized for the pneumonia, for the bronchiolitis. And especially if it is affecting the babies, you find that they are usually hospitalized because of that. So for you who is a mother or anyone taking care of a young one, make sure you're very careful, especially in these types of seasons. If it's too hot or it's too cold, some of these viral infections are prone to bring out droplets that will also spread to the babies, and they'll be exposed. So for you who is an adult and you're coughing, you are sneezing, at least try to make sure you avoid contact with the babies or the young ones, because of their body is not having so much well-equipped immunity to fight against those infections that you'll be spreading out to them. Now, I want to thank all of you who have joined us in our program. Please don't forget to share. Keep sharing so that we can all learn. I wanted to extend more emphasis on how we can prevent these respiratory infections. So if you make sure you frequently wash your hands, yeah. I know of late we've been washing hands in this coronavirus, and it has become so monotonous, but I think to some extent it has been of great help, because some people have really tried to learn how to be clean and by washing their hands regularly. Some of us have learned to use sanitizers. So please keep washing your hands regularly. So if I mean regularly, okay, whenever you see water, feel like you want to wash hands, because our hands carry a lot of things that go really so unnoticed. So please wash your hands regularly. Cover your nose and mouth. If you're sneezing, if you feel like you're sneezing, you never know. You may have the virus and you don't know, and you are asymptomatic. Someone who is asymptomatic does not present with any symptom. You have the virus, you're infected, but you have no symptom. You don't have any flu, you don't have any cough, you don't have anything. Sneezing is something that comes involuntarily, it just happens. So if you feel like sneezing, make sure you cover your nose and mouth, and always wash your hands even after that. Just make sure we avoid those droplets going out to other surfaces. And then also, if you find out an individual has that infection, it could be a common cold, it could be a flu, try to make sure you're not in direct contact with that person, so that you avoid further transmission. Yeah, usually flu cases usually spread so easily because most times people are not really so careful to be much more aggressive upon the spread of the droplets. So you find that they're sneezing anyhow, they are not covering their nose, they're not covering their mouth, they're coughing and they're not covering. And sometimes you hold your mouth while you're coughing and then you do not wash your hands. You end up touching surfaces and another person touches that surface. So the flu keeps going and going. That is why it's so easy to find that if one person gets the flu in one household, the whole household will get it, just because we are not being so much careful. So please also try as much as you can to disinfect hard surfaces. And what I mean by hard surfaces is that you try to disinfect all the tables you're working on, anything, the chairs. Try to make sure you disinfect them. And if you know that you have the infection, this is not a crime that you have it, but try to make sure you don't spread it. So by washing your hands, disinfecting surfaces, covering your nose and mouth while sneezing and coughing is something that you can do to help other people not get the virus too, the viral infection too. So also, like in your day-to-day life, try to make sure you avoid touching your nose, mouth, and lips. I'm very sure some of these have been really thoroughly taught in this season, especially in the emphasis of the stopping of the spread of the coronavirus. So please just do this. It's not just for the corona thing. I'm not teaching about corona, I'm teaching about a common cold, respiratory tract infections, but these are things that we do that help us even avoid other things. So just keep embracing what you've been doing. Don't get tired of washing hands. Even when there is no more corona, keep washing hands, please. Do not stop. And even when you feel like your hands are peeling off, just keep washing hands with soap and clean water whenever you see water. So that is that for the respiratory viral infections. So if you have a child with those symptoms, because it's so easy to manage in an adult, I'll be able, of course, to explain to you how I feel and what you're feeling, and you find a solution. So if you have a child, sometimes if the babies, very young babies, you find that it will create discomfort with them, a mild fever, and you find that they are not able to breastfeed, then you need to seek medical attention, because it's not healthy for a child to last for so many hours without eating. So of course it will cause some other complications that may need you to be hospitalized. So if you find that your child is developing these signs, trying to sneeze so frequently, and your child is coughing, maybe starting to kind of cough, sneezing, and you feel like they are getting difficult in breathing, please rush to the hospital and then seek medical attention before everything gets to a complication state. So please, everyone, take note of your child, take care of your children, take care of yourself, and be very, very careful whenever you have an infection of the respiratory tract. And I hope we've all understood about our respiratory tract. So common cold, the flu, it's all that in the respiratory tract infection. So please just take note of that. So we have other viral infections too that are caused, that do not manifest in the respiratory tract. So when we are talking about viral infections, actually, usually they are affecting, like I told you earlier on, they're affecting so many parts, so many areas of the body. So please take note of everything that is around you. So let's look at the viral skin infections too. I want to still continue thanking you for watching. Thank you for joining us. Keep posting your questions. I'll be glad to answer your questions, and please send us those messages here. And if you are not comfortable sending them here direct, please, there's a number on your screen. You can just look at your screen and you'll see that number. Send us a message on WhatsApp, call us direct, send us an SMS. We shall be able to answer you right away. So among the viral skin infections, we'll talk about the molluscum contagion. Now, these always cause small flesh-colored bumps. Yeah, okay, some of them, just some of the people, for you to understand, these are just bumps. Usually they come, but they disappear on their own, and mostly they affect the children, the toddlers, 1 to 10 years. The fact being that they are a child of 1 year is just now starting to learn how to walk, they're still crawling, and so bumps usually these kids are usually so exposed to having those kind of infections. So with this infection, usually it disappears and heals on its own, and you find that you need no treatment for this. You just need to keep the child clean and maintain the hygiene, wash hands, and keep the child's skin dry. And if a child of more than 3-4 years, that child is understanding, so you can teach this child how to keep him or herself clean so they do not get bumps. So among the viral skin infections, we also have the herpes simplex virus, and this virus usually causes cold sores, and these are usually transmitted through saliva, by kissing or sharing foods or drinks. So for this case, if your partner has this virus and you're kissing with that person, you find that that the virus is transmitted to you. Or if you're sharing food with the same with an infected person with the same forks or same cup with that person, you find that you get it. And you find that these people usually they infect the infected individual. Sometimes also may get the genital herpes. Now with the HSV1, you find that it is usually associated in sexual partners or people sharing the same cups with an infected person or people sharing the food. So, but this is usually not so common, but it can always happen to those people with a compromised immunity. So if you have an underlying disease you're treating for quite a long period of time, please, you need to take note of that. So you need to take note of whatever happens to you so you can easily try to notice a change in your body or in your immune system, depending on what you are dealing with. We also have the varicella zoster virus, and this usually causes the itchy, oozing blisters, and also is most times associated with high fever, and usually it manifests with the same characteristics as for chicken pox. So you find that it causes the itchy, oozy blisters. So you find that on your skin you experience that called oozy blister. So oozing is something like you find that the blister on your skin will start bringing out some water, kind of some fluid on it. So it keeps on flowing and it's itchy. And if you find that it is affecting the young children, you find that if they keep scratching it, they will now have wounds on their skins, and this is not a really great experience. Sometimes you find that if this is associated with a fever, with the oozy blisters and they are itchy, you find that the child is so uncomfortable, and you can never be uncomfortable. It is not only for children, but it can affect all ages. So if you have this kind of experience, you have this kind of symptoms and signs, you please need to seek medical attention, and they will always find a solution for the oozy blisters for you, so you can avoid a spread. So how do we avoid the skin infections? You avoid skin-to-skin contacts, avoid sharing clothes. We talked about that. The health worker was here was teaching about ringworms and was talking about sharing of clothes. So it happens even with this, please. Skin-to-skin contact is something that you have to take note of, and you have to avoid with the infected person, and also avoid sharing clothes with those people that are infected. Then also you have to take note of where you go for your communal showers. If you have a shower for so many people, a swimming pool, please, sharing towels. This is something that exposes you so much to this kind of skin infection. So please avoid skin to skin contact with the infected people, and avoid sharing clothes, and then also avoid communal showers, avoid communal swimming pools, because usually if they're communal, they're not really well taken care of, and they're not so like attended to and treated. So please try to avoid communal swimming pools, and avoid contaminated towels too. So some of you go to book places for swimming or sauna, anything of that kind, and you leave your towels there. Please try to make sure they are well taken care of. You may choose a locker to lock them in if there is provision, and if there is no provision, you could take them home so you can be safe from those skin infections. Thank you so much for joining us. You're watching Bigo TV here in Aksaray, Istanbul, Turkey. And here at Bigo TV, we are having so many programs. Today is a Monday, and you're watching us on this program, Obulamu. And tomorrow we have the Overcomers Prayer Altar starting at 9 to 10 p.m. And I bet you'll be so blessed if you were looking for someone to pray with. If you're looking for a prayer partner, a prayer time, please keep joining us every Tuesday at 9 to 10 p.m. And every Wednesday, if you're here around Aksaray, around Istanbul, you can join us for intercessions here at Big God Church, Big God International Revival Ministries. It's always open for those who may want to go before God and intercede. Please come and join us from 8 to 10 p.m. every Wednesday, and that is not broadcasted live here. So if you just want a private kind of talk with your God, you can come and always join us every Wednesday. And every Friday we have deliverance services here every Friday. So please come and join us from 8 p.m. Come and be blessed as you get delivered in our services. And every Saturday we have program Song on Point. Please come, keep watching, keep subscribing, keep waiting on to see. Come and join Song on Point. It is a very lovely program hosted by your favorite presenters, Mom and Grace. They're really so fantastic ladies. Please always come and join us. Always broadcasting here on Bigo TV from 4:30 to 6:30 p.m. where you can request your song, be encouraged, and give your testimonies in case God is doing so great wonders in your life. You can choose to share your testimonies on our program Song on Point, and then you can also be encouraging someone else. On Saturday, still from 9 to 10 p.m., we have the worship moment. For those of you who love worshiping God, who love singing, please join us in our program Worship Moment every Saturday from 9 to 10 p.m. with a Chosen Generation Choir. You're going to be so blessed. And every Sunday you could come and join us in our services, broadcasting still here on Bigo TV, morning service here starting at 10 to 11:30, and a main service also starting from 11:30 till 2 p.m. Come and join us, and I'm sure you'll be so blessed. Thank you so much for joining us. For those of you who are watching me, Miriam Grace, thank you so much for joining. You're saying thanks for the program. Begumisa Francis, thank you so much for watching. Mwesigwa, hand love. Thank you so much for watching. At Higher Catherine, thank you for watching. Begumisa Francis, you're saying, yes, talk about it, always get sore throat whenever it's too cold. Yeah, I'm glad that you've been watching, and I hope you have been you've been answered and you've gotten to know the reason why. Sometimes that the sore throat comes because of that respiratory tract viral infections. So some of them disappear without medication, and some of them may need medication. And so please, I encourage you, please always contact a health worker that you trust, so you can always be answered. Flavia Hilda, thank you so much for watching. You're saying thanks for that show. Blega Kano, thank you for joining. Benon Bless Washington, thank you for joining. Oh, Blega Kano, you're saying I should start afresh. I'm very sorry, I cannot go back to the very start of the program, but I encourage you, please, you can always watch these videos on our YouTube channel. You can just go to YouTube and type in Big God Church, and there you'll find these programs, and you get to listen and learn each and everything that we've learned today. Muksa Sylvia is saying, sure, sister, bless. Thank you so much. God bless you too. And Shanice Maureen, thank you so much for joining, and God bless you, all of you who are watching. Thank you, all of you who are watching. Thanks for sharing these videos. Thank you for liking, and thank you for sharing the knowledge with your other friends. Because whenever I share, whenever you like, and whenever you're asking questions, we are learning together. At least I know you are learning, and I know you are following, and I know you don't want to remain with the information all alone. So thank you for the good work you're doing, and may God bless you so much. So still on our programs, we still have Yosomo Vitegera broadcasting here every Sunday from 3:30 to 4:30 p.m. So please, if you want to learn more about the Bible, learn more about scripture, get to know more about God, what he really says, you can always join us in our program. And we also have Save This Generation, always broadcasting from 5 to 6 p.m. here every Sunday with our presenters, our dear pastor and our dear mommy Imelda. And I want to send out my shouts to you, dear pastors, Pastor Via Daniels and your family. Thank you so much for the platform, and may God bless you. We love you so much. Pastor Matovo Isaac, with your family, thank you so much for always watching and joining us. And thank you for the platform you've given us to share with different people in different states of the world. And for those of you who are streaming live with me right now, thank you so much for not remaining the information. So I hope, Ken of Lega, you're going to go back to the videos and watch from where we started from, so you can get to see it and learn this information right from where we started from. So away from the virus skin infections, we are proceeding forward to the foodborne viral infections. Like I said earlier on, there are so many viral infections, and they affect the whole body system. So we are going to be looking at these infections little by little, bit by bit, and we shall we emphasize on those that are so common that we know of, that usually come sometimes, that we do not even know that they're really a great risk to our lives, and yet we need to attend to them. So we are proceeding to the foodborne viral infections, and these usually are spread, the most common causes of food poisoning. So when we talk about food poisoning, it is not usually that there is poison put in your food. It is usually food that has been contaminated by some viruses. So you find that you're taking in the food, and these also vary depending on the cause of the virus that is causing the food poisoning. Usually, you find that different viruses cause different symptoms, cause different signs, and they manifest into your body differently. So we'll look at hepatitis B. This usually affects the liver for a few weeks, sometimes up to several months. Usually you may find that these may manifest or present. A patient with hepatitis A will always present with yellow skin, nausea, diarrhea, and vomiting, but this can be attended to and can be treated. So if you find any of those symptoms, I'm emphasizing on you seeking for medical help in health professionals. Please find someone you trust who is a health professional and stop. Don't just rely on Google and don't just rely on self-medication. Always try to see that you attend or you go and seek medical attention from a health worker. So please, always I'll refer you to that. So if you have any of these signs and symptoms, you have nausea, you have diarrhea, you are vomiting, and your skin is becoming yellowish from your normal body look, please always try to see that you seek for medical attention, and they will always have a question, an answer for you, and they will always have something to do for you so they can stop further damage and further spread. So we have the noroviruses too. These are among the foodborne viral infections. So we have the norovirus, and this also is actually usually responsible for the outbreak of severe gastrointestinal illnesses. So when I talk about gastrointestinal illnesses, I'm talking about the system that is concerned with the gastritis. Let me say from your throat to your stomach up to your intestines. Yeah. So if I say gastrointestinal illnesses, you just know that is just, of course, these will always connect from your whole system of the respiratory to your stomach, the gut, and then your intestines. So, and I already talked about the respiratory tract infection. So we shall go bit by bit. And as I told you earlier on, our body is a system. Our body works in a system. So most of these infections too may connect from system to system. You find that you get the gastrointestinal infection from a respiratory tract infection that was unattended to. So it is so very common and it is usual, but you can only try to differentiate that if you go and seek medical attention. And for those of you who are good readers, thank you so much for always reading, because it helps so much. You get to be enlightened on which kind of questions you have to ask. You get to know when to ask, what to ask, and how to answer, and you get not to be offended when you see that your doctor is not really is actually asking quite a number of questions, because it's actually where we base on to kind of get your right diagnosis and see a way forward for you that will be best for your condition. So always don't feel so offended if someone if your health worker is asking quite a number of questions to you. It is because they want to find out and want to make sure they get you a right diagnosis for your conditions. So don't feel offended to always present your signs and symptoms in the way they are, regardless of what they are, because usually they are the ones they base on to kind of get your diagnosis. So for those of you who are not able to ask your questions here, please try to send your questions on our WhatsApp number that is on your screen. You can send an SMS, you can always be answered, and you can give us a direct call, and we will usually answer you. So Blue Candle, thank you so much for joining, and please be blessed as you share. Blega Keno is asking, I feel pain inside my stomach and I have no problem with it. So what should I do? Because being sovet the nang. Now, Kenny, if you have pain in your stomach and you have no problem. Now, what is your your concern? It means you actually don't have pain, because you can't have no pain. You can't have pain and you have no problem. It means by the time you describe it as pain, it is already a problem. So if you don't have a problem, it means you actually have no problem. So if you have a specific question about that, please, I kindly request you can please send in your question again. Be specific. And I would appreciate so much if it is really concerning this presentation that I'm making right now. Kunya Sanon, thank you so much for joining. You're saying thanks for letting us know about our health. You're listening. Thank you so much. I know you're in Uganda. Send our regards to our dear brethren. Thank you so much for always joining us. Kaka Bashir, thank you so much for joining. Nguchi Barnabas, thank you so much for joining, and please keep sharing, keep sharing. Kaka, you're saying praise Sister Esther. Praise God, Kaka. Thank you so much. I'm so humbled that you joined this program, and I know that you'll be blessed too as you share these videos and as we learn together. Anguchi Barnabas, make sure you share these videos with your friends so we can all learn together. They can all benefit together in this program. So let's continue with the foodborne viral infection. So talk about rotavirus. I'm sorry, our time is so much spent so far right now. And please, if you have any questions, I still encourage you, please keep sharing, keep sending in your messages. If you have a WhatsApp, you can always send in your message on our WhatsApp number on your screen. Or you can, if you're in Turkey here, you can give us a direct call. If you you want to send an SMS, you can always send it on the number on your screen. And if you're looking for a health worker you can trust, you can always reach out to the number on your screen, and we shall be there for you to answer for you your questions that you have. I want to remind you, you're watching Big God TV, broadcasting live here in Turkey, Istanbul city, Aksaray, Kumkati, and we are hosted by Big God International Revival Ministries. We are based here in Turkey, and thank you so much for always joining us and for sharing our videos. I know that you always be blessed with our upcoming programs too. Don't forget, tomorrow is Tuesday, and we will have the Overcomers Prayer Altar. If you want to pray with someone, you're looking for someone you can pray with, you can join Brother Donland from 9 to 10 p.m. He will always be there to pray with you. And I know that God is faithful. He will surely answer our prayers. So I want to introduce our new subtopic, rotavirus. Now, this virus usually causes severe watery diarrhea, and this usually may lead to dehydration. It is most often in the babies and the young children. Now, with the rotavirus, it's something that is usually affecting the babies, but doesn't mean the adults don't get too. They also get affected, but mostly it is manifested in the babies, and you find that this virus causes severe dehydration and severe diarrhea, and it's so watery, and if you do not take caution, your child or you, the infected person, will get dehydrated. So with this, the rotavirus and noroviruses always cause almost the same signs and symptoms, and they are always responsible for causing most of the viral gastroenteritis. So please, if you have a child, with this rotavirus, I'll specifically based on the children. So if you have a child and this child is having severe watery diarrhea. Now, if it is for you to see that it is severe, you find that the child is passing watery stool and it is so frequent, and you find that this child usually is not able even to feed because it will be associated with vomiting, and it will quite be so much, and they will have abdominal discomfort because they usually have the pain. If the child is able to speak, they usually tell you, I'm having pain in my stomach. And if they're not able to speak in their babies, you find that they're always so uncomfortable, and they're really so uncomfortable that diarrheating. And if they're not vomiting, they'll have nausea. If the child is able to speak, they'll tell you they're having nausea, they're experiencing nausea. And so if you're seeing any of those signs, whether in a child or on you as an individual, as an adult, you have to you may need to seek medical attention. Now, with the rotavirus, you find that because of the severe watery diarrhea, most times it is so easy for this person to get dehydrated, and this comes along with so much more complications. You may need to see a doctor if you see that you are having diarrhea for more than 24 hours. That is if you are an adult. If you're having frequent vomiting. For those of you handling children, don't wait for 24 hours. Please seek medical attention, because now this child will be having watery stool and it is severe, and will not be vomiting, will not be able to feed because of the much vomiting, and they will start getting so lethargic, and they will be so weak, and because they are not feeding, please, you need to seek medical attention immediately, because you will not need to wait for all of this to happen. Now, I want to conclude with this, as we shall continue to look at more of the signs and symptoms of rotaviral infections in both children and the adults. But our time is so much fast spent right now, and I want to encourage you, please keep watching us here on Bigger TV. Keep sharing our videos, keep joining us, keep asking your questions. We are going to continue this topic next Monday. Now, prepare your questions for me next Monday, as far as we have discussed, and as far as rotavirus is concerned, because we are going to discuss about it more. We are going to elaborate about it more, and I know you're going to be able to manage this even while you are at home, or if it is getting severe, you'll be able to notice, because we shall be able to explain to you how it manifests. So I want to remind you, please, if you have not yet subscribed to our YouTube channel, please type in Bigo TV, and you'll see the link coming in, and you click on the subscribe button, and you always get notifications whenever I put down new videos. And you can always find these videos on our YouTube channel. And if you're on Facebook and you've just seen this for your first time and you've never joined us, you can send us a friend request, so you can like our pages, and click on your notification button, so you can always keep posted on whenever we are live. Randa Rhodes Kamba, oh my God, I'm so humbled. Thank you for watching. Randa Rhodes in the US, thank you for watching. Henry Isavier Prosper, thank you for watching. Unfortunately, you found the program ending, but I know that you're going to find this video on your Facebook, and you also find it on YouTube. You can always join us and watch these videos and enjoy more and get to learn more about this. And Tumsime Sikola, thank you so much for joining us. I'm so humbled. Isabi Henry Prosper, thank you for the selfless service. Thank you so much for appreciating Dr. Henry. Thank you for joining us. I'm so humbled when I have people like you joining us, because I know you supplement, and we shall keep teaching the communities together. Ivan Kutesa, thank you for joining us. Please don't forget you can always find these videos on your Facebook even after we are offline or off the video if we have ended our live videos. And you can find us on our YouTube channel, Big God Church, and subscribe to our channels, and you will find these videos there and keep learning. Please don't forget to always send in your questions. I can always read them, and we shall start on those questions next week on Monday. I want to remind you, watching Big God TV, broadcasting live here in Aksaray, that is Istanbul, Turkey, and we are based here in Kumkapi at Big God Church International Revival Ministries. I have been Ebiachu Esther, and I've hosted your program Obulamu for today. Thank you so much for joining out. I want to wish you a very blessed week. Have a good night, and may God bless you.
All the ghetto massive them, what is a special message unto you? Listen to the ghetto president. Entertainment massive now. Teni nomo kisa bange katingu kose sakusome sabantu bange ebisanira. Awenda bechitufu mbabuza kubanga bobe bantu bange nzije nakulira. Awenda bechitamwe nababulira. Ezuzembera zange katikwe ngendera. Chewenda bakajonjo ukulisole kubuza nekugamba kikateka. Omubuza yasimu omulalo nakugamba kizempaka. Alina magezi awulira neyesotinga talina magezi yantawa. Bino byenjogerako bwe bikunyiza goma kubanga gwe gwenyamba. Kati waliwo ebitusalako bulamu bwaffe nga naye tukubyesibako. Netunenya bafuzi titebatufaako naye nga bwotunula mu baanakola ki. Omutobe engalo zolinda bakugambe kingova mu kabuyonjo basinabakawo. Mbulira oba olinda bakugambe kyamatsiko kunywa nako bakafumbako. Ebintu by'obulamu tubijjemu ekyejo tubibayonjo. Obujjaku bwe butusibako endwadde tubibayonjo. Ebintu by'obulamu tubijjemu nsaaga tubibayonjo. Obutaswala bwe butusibako endwadde tubibayonjo. Labana kalwadde akatwesiba kakasinga kava mu bujjaku bwe twesibamu. Omuntu bw'otana bw'omanya tina magezi golina nago gakuggwamu. Anange nembuuza omuntu omulamu ku mubiri naye mutudyeko. Tuleme kukula nga tudda buto banange mutuleke nammwe musaleeko. Mazima tuzirika buzirisi ne tutunula nga naye bannaffe bakufaako. Okuba omuyonjo tolina kuba mugagga kimanye kiyamba bulamu bwo. Bayagala ensi yo n'obulamu bwawammu gamba kyekuzunga yange eno. Tube bayonjolo tube balamu bulungi ensonga yange ezi. Ebintu by'obulamu tubijjamu ekyejo tube bayonjo. Obujjaku bwe butusibako endwadde tube bayonjo. Ebintu by'obulamu tubijjamu nsaaga tube bayonjo. Obutaswala bwe butusibako endwadde tube bayonjo. Yeah man, so remember this, all the ghetto youth and all the uptown youth. What is your personal responsibility to clean up yourself and your environment? Because it's the only way we could have saved the world and avoid diseases. Style! Abantu bombi boga yeffe tubikola bino ne tumala ne tefuula batabiraba. N'endwadde zitusalako tulaba emyala gy'ebimba tuwoza City Council. City Council yobula kasasiro namuyisa mu kibuga nga kunkomu kakazambi. Embwa ze batomera ku nguudo zivundirako buli omu atunulidde munnewe. Kazambi gwe mukasuka mbubeera yazibikira emyala wono n'owulira kolera. Abamu babutula buyonjeza bwingi kuba etonye byonna byonna bitwera mbaneiga. Mubanda kati kasita bagambye obuyonjo kye kibawese kitiibwa. Para Uganda mu